Before agreeing to cosmetic surgery, it's very important that the patient looks for a competent and qualified surgeon, a member of the Australasian Society of Plastic Surgeons. And during the consultation, it's important to understand what are the aims, what are the expectations, maybe some limitations, and how is the recovery, possible complications. So once they have a full understanding of the procedure and the financial constraints, and then it's probably time to move ahead. A member of ASAPS is someone that's been qualified as a specialist plastic surgeon, and they've been through the training program, passed quite complex examination, and have been accepted after recommendation of other members of the society. So they normally will have strong continuous medical education. Oh, that's very important. I think building rapport and trusting your surgeons is crucial. You're giving yourself for their treatments, so it's very important that there is this trust and good communication. With rhinoplasty, it sometimes can be challenging to be on the same page to what the patient expectations are or what are the possible outcomes. So if both understand that well, then the chance of having successful treatment are greater. It's extremely important. It's a tridimensional structure of central in the face, which is quite difficult to visualize changes. So I really like to spend time with patients, asking them to show me what it is that bothers them, and then trying to replicate some of the changes before surgery so we can both together look at it and see if we are talking about the same thing. With plastic surgery, maybe with all other medical specialty, it's very important that the relationship, the rapport, and the patient feeling comfortable with the surgeon. If you find a doctor that you feel comfortable with, that has given you good information and makes you feel supported and comfortable, that's very important. If someone's not sure, that may be the time to slow down, think about it, maybe get a second opinion. And as a matter of fact, sometimes patients get a second opinion and return to the first surgeon. So I don't think that should be seen as a problem. I think that should be encouraged. I have a minimum number of appointments that I like to have, but in reality, I'll see patients as much as required. So normally they have a first appointment where we will have a general discussion about rhinoplasty, and I like to see them twice before surgery. And the second appointment, it's a more in-detail appointment focused on their specific problems, and also gives us the opportunity to discuss informed consent at depth. Then normally they will be seen then after surgery in the first week, 2 weeks, 1 month, 3 months, 6 months, 1 year. So that's how I like to see them. So it involves both the aesthetic and functional components. You should not look at it separately. You need to have a nose that looks good but also works well. It's important for breathing, and that's very significant in terms of surgical planning and what type of technique will be required. The incisions for rhinoplasty can vary depending on the procedure. The most common is the open rhinoplasty, so there's a visible incision on the columella, and the other incisions are all hidden inside the nose. So most of the operation is done under the skin. So once everything's closed, there's only a fine visible line that's only really seen if you look from below. So it's a quite fine and hidden spot. The recovery is it's a bit more difficult to start with. There's usually swelling and bruising, and so the first couple of weeks the patients may also have some taping or splints, and that will probably make it difficult to attain routine work or study. After that, it tends to improve quickly, but the whole process is a long process. So there's general complications, as for most surgical procedures, with regards to potential allergy to medications or infection, bleeding. But there's specific points to talk about. With rhinoplasty, you can have, for instance, depending on how much structural work has to be done, there may be small irregularities that can be seen. There can be problems with breathing. There can be like a dry nose for some patients. That's a very important point. If they are unhappy, the first thing to do is acknowledge that and listen to why are they unhappy. Try to understand exactly what's making someone unhappy is very important, so we can address it the best we can. There's a number of things, and the surgeon must not assume what the reason is. So it's important, again, communication is key if you have a patient that's not happy with the outcome. And just being available and supportive, so you can go through a difficult time and hopefully turn things to a better outcome.